Reproductive organ is the testes. Just behind the testes is this expanded portion which is called as the epididymis. From the inferiormost part of the epididymis arises this structure which is called as the vas deferens. Now the vas deferens is not alone. The vas deferens along with it has got the testicular branches of testicular artery and branches of testicular vein. But the branches of testicular vein are not single but in the form of a plexus. We call that plexus as the pampiniform plexus. In addition, all these structures are wrapped around by the internal and external spermatic fascia. So because of those fascia, this becomes a cord-like structure, and that cord-like structure is called as spermatic cord. The spermatic cord starts its journey from the scrotum, goes up through the superficial inguinal ring, then passes through the deep inguinal ring, and finally enters into the abdomen. When it comes, it goes into the abdomen, into the pelvis actually. When it enters into the pelvis, it goes behind the bladder. And behind the bladder, in this model, you can see that it joins the duct of a gland, which is called as the seminal vesicles. So these are the seminal vesicles. This is the duct of the seminal vesicles. So duct of seminal vesicle joins with the duct with the vas deferens to form a single duct which is called as ejaculatory duct. So this small duct that you can see over here is the ejaculatory duct. And the ejaculatory duct is the structure that pierces through the substance of the prostate gland and enters into the part of the urethra that we call as the prostatic urethra. Now, the male urethra is longer, is about 20 centimeters in length, and is for the sake of description divided into various parts. The first part is the intramural part. This is the portion which is present within the substance of the bladder. The next part is the prostatic part, which courses through the prostate. The third part is the part of the urethra that pierces that deep transverse perineal muscle or urogenital diaphragm. This portion is called as the membranous part. The membranous part is significant because this is the thinnest part of the urethra and most liable to get ruptured in case of canalization of, the catheterization of the bladder, Foley's catheter. Thinnest part. Then next, this urethra enters into this expanded portion of erectile tissue, which is called as the bulb of the penis. So this portion is called as the bulbar part, and the last portion which is passing through the body of the penis is called as the penile part. Okay. So parts are intramural, prostatic, membranous, bulbar, and penile.
Where is the perineal membrane in this?
Sorry?
Perineal membrane.
Perineal membrane in this is over here. This line is the perineal membrane. So now let's talk about spongy. Okay, so we'll talk about this portion and the superficial and deep perineal pouches just in a minute. Where does the spermatic cord end? Spermatic cord ends. Actually, spermatic cord is a combination of a lot of structures. So your question would be, where does the vas deferens end? Yes. So vas deferens ends by joining the duct of seminal vesicles to form a common duct which is called as ejaculatory duct, which opens into the prostatic urethra. Okay. Now, when we talk about the male perineum, the male perineum similarly has got a deep pouch and a superficial pouch. The deep pouch is the region which is present behind the perineal membrane. So this is the location of perineal membrane, and this portion is the portion which has got the deep perineal pouch. The first structure that you can see is common, that is the deep transverse perineal muscle / urogenital diaphragm. Then laterally would naturally be present the structures which we call as the internal pudendal artery, internal pudendal vein, and the pudendal nerve. However, in case of female, you see that this structure was pierced by two things, vagina as well as the urethra, whereas in case of males, it is only pierced by one thing, which is the urethra. So the next content would be the membranous portion of the male urethra. But in case of males, the glands are located not in the superficial pouch but in the deep pouch. So over here, imagine that small glands would be located. These glands are called as bulbourethral glands. Within the substance of the muscle, in the deep perineal pouch. So the glands of the males, bulbourethral glands, are contents of the deep perineal pouch. That is all about deep perineal pouch. Let's go to the superficial perineal pouch. Now when we talk about the superficial perineal pouch similarly has got two caruras, the erectile tissue, the right crus and the left crus, both join to form a single crus at the top. So this is the single crus. The second erectile tissue, the bulb, which is in the center, is present in the center and is present in the lowermost part of the penis. So this is the bulb. The carura are covered by the muscle ischiocavernosus and the bulb is covered by the muscle bulbospongiosus. And along with the arteries and veins, which are actually branches of internal pudendal artery and veins that drain into the internal pudendal vein. That is, yes. Now, important relations. In case of males, the most important relation is the relation of prostate with the rectum. Now you see, for the sake of description, the prostate is divided into lobes. Prostate has an anterior lobe, a posterior lobe. Anterior lobe, the portion which is in front of the urethra. Posterior, which is behind the urethra. And a median lobe. The median lobe is the small lobe which is located between ejaculatory duct and the urethra, prostatic urethra. And then two lateral lobes. The left lateral lobe and the right lateral lobe. Now interestingly, the prostatic cancer most commonly occurs in the posterior lobe. Okay. Because it occurs in the posterior lobe, so it can easily be palpated by a per rectal examination of the prostate. However, benign prostatic hyperplasia usually presents in the median lobe, and as the median lobe is the smallest lobe which is present between the two ducts, it doesn't have any place except to compress the ejaculatory duct as well as the urethra. The compression of ejaculatory duct not that big a problem, but compression of the urethra starts creating problems such as bladder outlet obstruction. That is pretty much it. That's it.
The posterior and anterior lobe again.
Posterior?
Posterior and anterior lobe. Can you show it again?
Anterior lobe? Posterior.